All Cooper CPAs, located in the heart of East Nashville, offer a wide variety of tax services for individuals and businesses. Contact them at 615-257-0646 and visit their website, allcooper.com, for a full list of services.
Talkapolis, the social media TV network for your city.
Well, welcome back, everybody, to Political Soup. Crom Carmichael, Joe Williams. And, Crom, we are inching ever closer to the implementation date for the Affordable Health Care Act.
Mm-hmm. Talking about something misnamed.
Well, I was going to ask you. Every time I turn around, the regs are, the number of pages in the regulations are getting larger, and with every page, it's going to cost a little more.
Well, you have about 30 states now that have said to the federal government, we're not setting up a state exchange, and thankfully Tennessee is one of those, and told the federal government they're going to have to. The response last week was that the federal exchange will provide people with how, you know how many options of different plans? One.
Really?
Yeah, that's because they can't figure out how to offer more than one. So they're going to be offering one. Now, by the way, that's down from Obama's promise of multiple choices. So that's number one. But here's what's interesting. First of all, let's remember what the act does. Now, by the way, it's over 20,000 pages have been issued and more to come. But let's remember what it does. It says that children up until they're 26 can remain on their parents' policy. Number two, it says you cannot discriminate based on age for insurance purposes, which absolutely just nails young people because now they're having to pay higher premiums, even though statistically they're much healthier than other people. That's number three. You cannot not insure somebody based on a pre-existing condition. And number four, there is no lifetime cap. So you cannot say after $1 million, the insurance doesn't go into play. So all of those things added together will drive insurance premiums much, much higher. Some of those things have already been in effect, and so you've seen insurance premiums begin to go up. But in just 1 week, in the Wall Street Journal, here's a front page story, insurers see jump in health premiums. Then it goes on to say that in some states it might be as much as 70% jump in insurance premiums.
Why that much?
Well, because those states had a lot more flexibility in the past and their premiums were generally lower. And now that the federal government is saying this is what you must do, it's taking away the flexibility and driving the costs up. And it's based on what I said earlier. Right. Caps, elimination of caps, elimination of pre-existing conditions and all these different things. And so premiums are going to go up. Then on the 28th, that was on the 22nd. Then on the 28th, chains cut their health law tabs. Now what they're talking about chains here is they're talking about restaurant chains. What they're doing is they're saying to employees, we talked about, go ahead.
Is this not the same thing we've talked about before? Hey, when this goes through, all right, here's what we're going to do. We're going to just cut everybody back to 25 hours.
29.
29.
30 is there are two numbers to remember.
Okay.
30 and 50. 30 is the number of hours. If you work 30 hours, you're considered full-time. Anything less than 30 hours, then you don't have to offer them insurance.
Okay.
And the other is if you have less than 50 employees.
Okay.
Then you're
30-50 rule. That's right.
The old 30-50 rule.
So, but this has been this has kind of been the end of the road that we've been riding the whole time, and that is when it comes down to it, okay, so I cut staff and I cut the hours they work, and I don't got to do it. It's we used to say, well, I ain't got to do this no more.
Right. Now, and then the individuals are not going to sign up for Obamacare themselves, even though they get a big subsidy. They're not going to sign up for one reason. They cannot be denied coverage for pre-existing conditions. So what a lot of people will actually do is they'll carry around their application in their pocket signed, and if they have to go to the hospital, they'll present it as they're entering the hospital to get insurance to cover their stay in the hospital. Now people say, oh, they won't do that. Absolutely
sure
they will do that. It's the logic. You know, why pay $10,000 or $15,000 a year for insurance when you don't have to have it? You just hand it to them and you get insurance for 2 weeks and then cancel it. So we're going to see some of that too, which, by the way, that also drives up the cost of insurance premiums for those who are paying them on a regular basis.
Sure.
That was on the 28th. Then on the 29th, the very next day, here's another story. Insurance prices could jump. And then, once again, it gives from a different perspective. Well, when I say different perspective, it's a different writer coming up with the same conclusion. And this one is primarily focused on how young people are going to end up being they're just going to end up paying tremendous amounts of insurance, and to the extent that they are in businesses that can adjust their hours down to 29, they're going to see their pay cut and their insurance premiums go up. So that's a pretty rotten thing.
You know, I've two situations in my past that I'm familiar with. One in one particular organization that I worked for, as we were evaluating employees, and everybody was happy, and when they got everybody got decent, pretty good raises. They got a raise, then they got hit with the insurance increase, and they came into me going, Joe, how am I taking home less money?
Yeah.
I just got a raise. How am I? And this is going to happen again.
Absolutely. Now let's be sure, Joe, that one thing that I try to make sure that we cover on this show is I don't want to identify a problem without identifying the solution.
All right.
The problem is the third-party payment system is very, very expensive to operate. People have insurance for their homes for big-ticket items.
Right.
People have insurance for their cars for when they have a wreck.
Right.
They don't insure to buy a tank of gas. They don't insure to do an oil change. They don't insure for tires. They don't even insure for transmissions, which might be $2,500. Yet, if we go into a doctor's office or if we go to get a $20 prescription,
Yep.
it's insured. And now all of these other companies and parties get involved in adjudicating the final payment. All of that costs a tremendous amount. And I would argue that a doctor visit, if there was no insurance, none at all, a doctor visit would cost $30 to $40. People can pay $30 to $40. What should be insured in health care? The big ticket item, the hospitalization. And if that were all that was insured, then even that price would be a lot lower, because that's where the insurance companies would focus their energies on trying to manage costs. That's where they would do it instead of this absolutely ridiculous cover everything plan. So
if you could get it down to $30 to $40, I mean, that's kind of a copay now.
That's right. That's right.
So you're actually paying what it should cost. Everything the insurance is piling on is going to administrative costs somewhere.
That's right. You've got millions of people who are in the insurance industry. And by the way, I'm not attacking them. I'm saying the system itself is so bloated with bureaucracy because of all the government regulations. It is the way it is because of government policy. It's not the way it is because that's how consumers want it.
So the other situation, and this bugged me for a while, but 25 years ago when the HMOs were the hot ticket.
Right.
Worked for a company that we had an HMO. And, you know, at the time it was just my wife and I. It wasn't a bad deal. But it cost me, for my wife and I, the same amount as it cost a friend of mine in another department for his wife, and their 8 kids.
Okay.
And I just, there was an equity question to me there.
Well, even with HMOs, they tried to funnel you to particular providers. Mm-hmm. They still had to have a third-party payment system. Yeah. It is the third-party payment system that costs so much money. When I go to the doctor, there are 6 different companies, 6 different times that a company has to touch that invoice before it's finally paid.
Okay.
So it takes a $30 bill and drives it up to $100.
All right, then let me ask you this question. Why not have a single payer system, as in?
It'd be the same thing.
A government single payer system.
It'd still be the same thing. You still would have to have all these different. The insurance company would be similar to the government, just like Medicare and Medicaid, except the amount of fraud in Medicare and Medicaid is absolutely an immense amount of money. And so a single payer system doesn't solve the problem. It would be like saying, well, HMOs will work, but then they didn't work. Well, Obamacare will work, and it won't work. Well, let's go to a single payer. Well, you know what? Why not just let the person pay like you go to the grocery store? When you go to the grocery store and you buy $30 worth of groceries, you pay. And it doesn't cost much. The transaction cost is less than 1%. And even if you use a debit card, what is it, 1.25%? Think about that. If you could pay by debit card, and if you want to set it up with HSA, so everybody has a debit card for health care for these lower cost things, then your payment system is going to change from being 50% to 60% of the cost to 1. That will drive the cost down, make health care affordable. So that's where you have it. In kind of a related story, I saw an interesting article about, you saw this stuff over the weekend about these teenagers wilding in Chicago. Yeah. I mean, we're talking about in the most affluent shopping area in the country.
But wait a minute now. It's the first warm weekend. Me and my friends just wanted to go for a walk, and they had friends, and it just happened to be 300 or 400 of us at the same place at the same time.
Yeah. Taking money from the people walking down the street and mugging them. Here's what's interesting about Chicago, and the reason it kind of ties into this thing with Obamacare is that's where Obama cut his teeth on politics and everything else that kind of informs his life.
Yeah.
Look at Chicago. It has among the strictest gun laws in the country, yet it's the murder capital of the country. Number two, it is the cronyism in Chicago is unparalleled in the amount of corruption. Listen to this. From 1976 to 2010, there were 1,531, let me say that again, 1,531 public employees. This is people who work for the city who were convicted and put in prison for corruption. Now think about when we have, how often do we have somebody who's indicted and convicted in Nashville? 2 or 3 a year?
Maybe.
Yeah, I mean, that'd be a big year.
5 in the whole state. Well, okay.
Yeah, but I'm just saying, but this is a city. Now, yeah. Chicago is 3 or 4 times bigger than Nashville.
Okay.
1,500 in Chicago.
In what period of time?
In 25 years.
All right, so that's an average of 60 a year.
Yeah. I mean, it's just, and by the way, those are the ones that get caught.
Yeah.
And the shakedown racket in Chicago with property taxes and everything else, it is systemic. It's the way the city operates. The people who get convicted are the ones who get overly greedy. If you're just merely greedy, you don't get caught because it's part of the system. These are the ones who, even the greedy people who work for the government. And so, at any rate, I just find it fascinating, but I'm not surprised. And by the way, this is a precursor of what you're going to see, I think, in other big cities.
Well, but is it not also draw a parallel there? First off, I want to take up some for public employees. Out of the 1,500 there's probably 30, 40,000 who still do a good job and do a fair job. But it is these problem children that always seem to bring it up, get caught, and just ruins it for everybody. I mean, folks who really are committed to doing a public service.
Chicago, it's very hard to be. It's very hard in Chicago to be a completely honest public employee, especially if you rise up. You see the TV program,
sure,
which I love, Person of Interest.
Yes. And
they have the HR.
Yeah.
The corrupt members of HR.
Oh, yeah.
Chicago has a lot of HR in it.
Well, I was going to say, but I'm going to take up for them just like I'm going to take up for some teachers to an extent. But, you have this many done this way kind of parallels with what's going on in Atlanta right now.
Oh, my gosh.
With the education system
down
there.
I read about that, and you are right. I mean, this was systemic in Atlanta. From the top and all the way down.
And bullied down.
Yes, bullied down, requiring teachers to falsify test grades.
Change grades.
Oh.
Yeah. In case you haven't heard, there are 28 members, including the director of schools, indicted for changing grades. They got big stipends because the test scores went up. And so they made the test scores go up. And if the test scores didn't go up, they made them go up anyway.
Yeah, and a bunch of teachers got indicted too.
Yeah.
I mean, and what's sad about that is it went on for years.
Yes,
so
10 years worth of this.
Yeah, so you have children who went into the school in the first grade who were subject to this corruption, and they got a terrible education.
Yeah, they go to the 10th grade reading at a second grade level, even though they passed all the proficiency tests at a high standard.
Yeah, yeah. Now, here in Tennessee, you've got 2 things going on, which are interesting. One is you've got to move toward vouchers, which I have been supporting since the time you had to actually define what a voucher was,
right?
Which is 25 years ago, and I think that's just great because it gives parents the tools and the choice of where to send their their child to school.
Right.
That's number one. And then number 2 is you've got this law that says that if you are collecting welfare and your child is failing, that it looks like it's going to pass through the House and the Senate, that there's certain things that you as a parent have to do, and you're given choices. And it could be as little as attending parent-teacher meetings or enrolling your child in summer school. In other words, all of these things are things to essentially force.
Right.
Or let me change that word. It's not force. It's to encourage.
Okay.
Because if you don't do it, you don't have to, but you will get your government payments cut.
Well, and teachers have struggled for years with the fact that we do all we can, but if we don't have support from home, if there's not a firm home life, then no matter how well we teach, no matter how good we are at what we do, we can't reach the levels that we'd like to.
Yeah, and this bill essentially says if your child is failing and you are collecting government payments and you're not attending parent-teacher, your child is not enrolled in summer school, and I think there was a third one. I'm going to pull a Rick Perry. I can't remember the third one.
Attendance or something.
Yeah, attendance. Yeah, it could be attendance. If then you have to do one of those three in order to maintain your government subsidy, and I think that's entirely reasonable.
Kind of like having to pass a drug screen.
Well,
in
sure.
Florida anyway.
Yeah,
you know?
yeah. So at any rate, that's those. Oh, by the way, there's one other very interesting article in Chicago. We'll be very quick here, and this was written by William Daley, who actually served in the Obama administration. He points out that the fastest way to reduce gun violence, the fastest way, is to arrest people who are carrying a gun without a permit. If they're not entitled to carry the gun and they're caught with a gun, then they go to prison.
Well, that's everybody except a sworn officer in Chicago.
Well, it's a lot of folks, but in Chicago, in New York, when Giuliani took over as mayor of New York was the murder capital of the country.
Right.
And he put in a stop and frisk policy. Whereas if the police had the right to stop you and frisk you, and if they found a gun and you didn't have the right to carry it, you went to prison.
Okay.
The amount of violent crime in New York dropped. I mean, it dropped like 80 or 90%. It was tremendous how much it dropped over a 2 or 3 year period. So if you really are against gun violence, then what you need to do is you need to be able to arrest, convict, and imprison people. I don't care how long it is, because in New York, people don't carry guns illegally at nearly the rate they used to. And if you're not carrying a gun illegally, the chances of you using the gun are low because you don't have it.
But what about the cost of the court case, the length of time, and then the incarceration? Are you sure that people are going to want to pay the amount of money that it takes to take care of these folks?
Joe, what's interesting is there was initially a spike in arrests and convictions and prison time. It didn't take long, though, for the bad people to realize, you know what, carrying a gun is not worth it. And so they simply didn't carry the gun. If bad people are carrying guns, they will tend to use them more frequently than if bad people are not carrying guns. And so the penalty was such that people chose not to carry the gun. If Chicago wants to eliminate gun violence, that's what it needs to do. And a person who served in the Obama administration and who lives in Chicago is saying exactly that. So I applaud Bill Daley for saying that.
Yep, you heard it here first. All right, we've gone a little long this segment. When we come back, we'll wrap all this up with a very dynamic final 5 minutes. We'll be back after this.